What about the fear of missing out and its consequences and correlations with other symptoms? FOMO and interpersonal stress are associated with insomnia and subsequently poor mental health outcomes. In another Chinese study of university students, researchers found negative effect, which is a general dimension of subjective distress and unpleasurable engagement that subsumes a variety of aversive mood states, including anger, contempt, disgust, guilt, fear, and nervousness, was linked with poor sleep mediated by FOMO. We have this constantly, but always a symptom is something that is related to a major cause, to a major why this is happening. So, this fear of missing out is just a consequence of it, of a major situation that needs to be taken into account in our lives and in a personal matter. Also, the blue light from electronic devices can affect sleep. A short wave blue light that has to be at a certain distance from our faces, for sure. The postulated mechanism includes suppression of the pineal hormone melatonin, leading to a state of neuropsychological arousal. These alterations in circadian rhythm may link to increased sleep latency, reduced sleep duration, and increased daytime sleep. What about daytime sleep and night sleep? We all have our internal clock. So some people function better in the morning or during the night. This might be variations of that internal clock that we have. So if I know that I already work better during the night, then I will be feeling more tired during those times in comparison than before. So that could be an indicator that something is happening. Same for people that are more awake or they work better during the morning. But what about this type of neurodevelopmental disorders? We definitely need more researches about it. And we definitely need more studies that could indicate the relationship between the fear of missing out and current mental health issues, or better said, mental health disorders. The young adults with higher levels of FOMO are less likely to report their own lifestyle as healthy. The feelings of envy and social exclusion are also linked with poor eating habits. Who would have thought? Sometimes people are having some levels of distress, and then we have these secondary effects that we tend to confuse for something else. For example, I'm having a bad work-life balance, and then I'm starting to have headaches from one day to another, and I've been like that for a month or two. Another example could be for people starting to have nausea with types of foods that were already like good for them in the past. Another indicator could be having a fear of missing out, having the need to be part of a group, having the need to know what's going on in other groups in a very intrusive way. And without that person not even knowing why, that could also be an indicator that something is going off. It's not always a physical reaction from our body, it's also a psychological reaction. That could be also a possibility. So when we say secondary effects, we are likely most of the times linking that to a physical reaction, not a psychological one. So it's also very important to include that into the matter. Sometimes the distress isn't physically demonstrated. Our organism has so many ways to show us that something is off. And that is when we need to learn first how to understand our own organisms, how to understand the signals, and then act towards it. When we go to the doctor, most of the time it's because there's nothing else to do. It's too late to make that analysis because that analysis takes time. So when we go prior to it, we can actually avoid having a bad diagnosis and also having a bad treatment. But of course, that could be the ideal scenario to have everything on time, to have the specialist to take the time and not only evaluate your organism and its reactions, but also to evaluate the rest parts of your life and the rest parts that could be affecting your current physical reactions because it is a reaction. Your body reacts to something. It's not that it's sick out of the sudden. It is sick because it's reacting, battling something inside. That's it. The body reacts and is reacting to something. But what about a treatment? What about something that we could do to avoid all of this? We have the cognitive behavior therapy, CBT. CBT addresses story connections with is postulated to be underlying its development and maintenance of these conditions. It also addresses underlying anxiety and focuses on the predisposing or predisposing factors. The main treatment goal should be control rather than abstinence. FOMO reduction is designed as a model aimed at building resilience by focusing on self-help literacy guide about design and appropriate use of these social media platforms and electronic devices. Therefore, it is an active, effective, user-friendly, safe to anxiolytics and self-help technique relying on dealing with the circle model of anxiety. The method associates between the concepts of use, fears, and technical countermeasures. The effectiveness of cognitive reappraisal of anxiety has been recognized in helping people actually be aware and manage their digital dependence. Compulsive behaviors can be regulated using techniques such as distraction and reappraisal. Distraction avoidance techniques are also part of FOMO R. That could be the CBT, behavioral therapy for it. Excessive involvement in the targeted behaviors leading to self-reported functional impairment tends to be fairly transient for most individuals. Hence, the excessive behaviors such as FOMO are often context dependent, and that spontaneous recovery is frequent. Individuals are also offer alternative strategies and opportunities for connecting with other people without having the feeling of missing out on something. Some studies have reported use of anxiolytics and found it helpful as well. So everything that have been verified, used, and had positive reactions can be also an alternative. But always do your research and go with a professional. FOMO may start with the story thinking related to sense of fear of being left out, from a rewarding experience. The brain always wants something at the end. However, it is reinforced with constant responsiveness to the stimulus. Some research also terms these behaviors as compulsive. We continue to doubt if these behaviors are of obsessive nature, but clearly constantly checking and browsing. That's part of it. These behaviors are in several domains as discussed earlier. We also have the hypothesis that the complex nature of FOMO could be due to rapid change in technology in the last 2 decades. And it's continued to rise. There's something curious that every time a new technological advancement is launched, people are surprised or not entirely ready, so we misuse of certain technologies. That's what happened with AI. Not everybody was prepared for it, and then we started to misuse it. And then we found out the consequences of it, that it actually uses a lot of natural resources to work and to function. So after we found out that, then we started to condemn the misusage of it, but that was later. So these technological advancements also have an internal background that doesn't care much either society is ready or not. That is also something to talk about in digital humanities. Where's the digital and the humanity part correlating in there? But yes, these technological advances in the last 2 decades can also fed or be something that could be a tool in order to develop FOMO, because FOMO without technology could be slower perhaps, but of course, social media platforms introduced by modern technologies are also helping to increase that stimulus, and it's easier to get into it. Social anthropology studies have demonstrated how SNS may be impacting social norms. However, it will be a fair argument that human cognitive processes have been lagging behind a rapidly changing technology interface. These researchers are an attempt to recognize and understand origins and psychological interplay with multiple brain processes. FOMO has been linked with not only distractibility, but overall decline in productivity and worse mental health outcomes. It has been established association with the sleep disturbances, social anxiety, clinical depression, and decline in academic performance, not to mention academical performances in various areas as well. But also, it could be also a lower capacity of productivity in working hours as well. It could be. It's not clear who all are vulnerable to FOMO, but it is observed that certainly personality traits of one with underlying mental health problems could be more affected. The measurement scale validated for FOMO has established in empirical researches that this could be extremely impairing and debilitating. Also, when we use the scales, it's like we're trying to have you some numbers ready. But of course, when we talk about personality and more human related traits, it's more difficult to put it into math. So there's also like a context challenge for the researchers nowadays, and it has been for a long time. But what about ADHD disorder? ADHD is a disorder characterized with deficits with delayed gratification, and theoretically, one suffering from ADHD will not only be vulnerable but also likely to have worse overall outcomes related to FOMO. That could be a great example. ADHD is strongly associated with internet gaming disorder, and we postulate that these subtypes would be more prone to aggressive outbursts. An alternative explanation of this phenomenon could be attributed to the negative feeling of envy. The most accepted reasons are lack of intimacy in these interactions and having a large group of social media where one constantly finds themselves to compare oneself with others. In its line of ideals, it is likely people will experience frustrations and envy from comparing oneself to others, but is still tempted in striving to be closer to the person of comparison. These behaviors could exacerbate negative emotions such as envy, jealousy, resentment, and anxiety, as well as the desire to chase social media perfection. Have you ever felt like this? It is likely the effects will be worst for individuals with mental health issues for sure. It could increase some stimulus, and those stimulus can develop or trigger us. The knowledge of these underlying psychological processes would be crucial for providing psychoeducation and also planning individualized psychotherapy based interventions. It's also interesting to know that FOMO is a global phenomenon. It can happen to everybody everywhere. After recommending screen time is exceeded, one is more vulnerable to access information and maintain social relations. And what about the kids? Someone might ask. Parental education also has been found to be highly effective measure to curb this. The American Academy of Pediatrics recommended family media use plan has that it has been like a useful tool and could be also preventive. Suicide prevention, promising research based on trans theoretical model has been an effective solution. It's interesting to know that a key feature of this intervention is making one understand how social media works. That's one of the main points of this. FOMO is a now established entity in the research community. However, many practicing clinicians are not aware of educated about it affecting their population. We need more courses about it. We need not only people talking about it, but also to have it on the classes, people teaching about it to the professionals in the matter. It's imperative these new findings are communicated to the clinical community and research over and over again because we need to do more researches about it. There is a need for further research, which includes prevalence studies. I would add more communities, more research groups with different people from different ages, different positions, different areas, all together and not at the same time. Because through the people is how we know if there is a tendency of not on a type of group or an individual or in both. Psychological understanding is also required and how we can battle this. And more evidence-based prevention and treatment interventions because now we have the disease. Why are we going and how are we going to solve it? Thank you so much. See you in another video.